Hi everyone. I just wanted to come on and do a quick video to go over some dosage calculation hints and tips for you and do a couple problems with you. First of all, I just want to throw up this quick conversion. This is something that you need to know, and most of you probably already know it. Definitely need to know this milligram to microgram in here, and I've got another slide a little bit later on that talks about that. Definitely need to know your liter milliliter, and this is the gimme one right here, that 1 milliliter and 1 cc is the same thing. The teaspoon, some of you were nervous about this, that 5 milliliters is 1 teaspoon. And then knowing your kitchen measurements, that 3 teaspoons is 1 tablespoon. Therefore, that gets you 5 times 3 gets you 15 milliliters. So 15 milliliters is 1 tablespoon. And definitely know the kilogram and pound conversion, because all medications are given in kilogram that are weight-based are done based on metric kilogram weight. So I put this slide up here as kind of a checklist for how to get through a problem. The dosage calculation test that you'll be getting in class is given on paper, but when you get dosage calculation questions on NCLEX or on the computer, you'll have a scrap piece of paper, so that's why it says, write it on a piece of paper. But there are certain things to pay attention to in the problems, and those are things maybe you want to underline or circle, and those things to be paying attention to is the unit of measurement that the question's asking for, and I'm going to point that out to you on a couple of slides later. What is the order asking for? Definitely. What conversions do you need to do? Now, solving the problem, I'm going to show you one way, but I'm also going to point you to a video that maybe shows you a different way to solve the problem. I hope that we talked about this in class, the use of leading zeros, the zero that comes before the decimal, but not a trailing zero. So rounding and not using a zero after a number, but definitely we want to use a zero before a decimal to indicate that it is a partial number. And then check your answers. Just with any math problem, check your answer. But in addition to that, be thinking about it logically. If you're coming up with a super large number for giving a pediatric patient 1,000 milliliters of Tylenol, that should make you have a red flag to go back and recalculate your answer. So here's a really simple one. This should say the provider, but it says the doctor ordered 50 milligrams of metoprolol, that's a blood pressure medication, twice a day. Now this is supplied to you in 25 milligram tablets in your med cart. So how many tablets will you give to your patient? Now this seems super simple, but working those steps, it's what do I need? Well, I need tablets. Well, what is the order? The order is for 50 milligrams. That's our unit of measurement. What conversion do I need? It's milligrams and milligrams, so there's really no conversion. And then it's solve the problem. I need 50 milligrams, but I don't know how many tablets I need, say. So it's 50 over X. And then what do I have? I have 25 is 1. And if I cross multiply that out, I would get the answer of 2. But that makes sense. If I look back at this, 25 and 25 is 50. So 2 is the right answer. Checking my answer makes logical sense. And giving a patient 2 pills is not unreasonable. So this is what I was talking about. What's the important information? Sometimes students get distracted by a lot of the other numbers that are in a question. So here we have the physician or provider has ordered erythromycin. This is an antibiotic, 1 gram in 100 milliliters of D5W to infuse in 30 minutes. Calculate the flow rate in milliliters per hour. So when we were going through our steps, we wanted to know, one of the steps was, what is the final measurement that I need? And the final measurement that I need is milliliters per hour. Now this 1 gram is kind of distracting. That's the dose. But it's not asking me for the dose per hour. It's asking me for milliliters per hour. So I'm looking for volume. So not this. I need to pay attention to 100 milliliters an hour. And it wants to know in this time frame, in 30 minutes. So in 100 milliliters, if it wants me to give 100 milliliters over 30 minutes, then I don't know what the rate is for 60. So I cross multiply 100 times 60, that gives me 6,000. 30 times x gives me 30. 6,000 divided by 30 gives you x, which is 200 milliliters an hour. So think about that. 200 milliliters an hour, and you only have 100 milliliters, you would run out in half an hour, which is 30 minutes. So this 1 gram is the distracting kind of measurement in there. So this is the volume and this is the time, and I'm trying to figure out the rate for an hour. Okay, now this one's a little harder. It's going to take us a little while to work through this one. The physician orders dopamine at 3 micrograms per kilogram per minute. You're going to hear nurses call this mics. So dopamine at 3 mics per kg. So kilograms is also called a kg per minute. Patient weighs 70 kilograms. The concentration of dopamine is 2 grams in 500 milliliters of D5W. How many milliliters per hour will the nurse program the infusion pump? Our ending number needs to be milliliters per hour. And this little asterisk here tells us the infusion pump only has 1 decimal place to round, so you need to round it to the nearest tenth. Okay, so we know we need to end up with milliliters per hour at the end. We need to look at some of our distracting features in here. So we have our order here, but we don't really know what the total dose is because we know we have to calculate that. Well, this is good. They gave us the kilograms already, so we don't have to convert pounds to kilograms. But look at this concentration. I've got a dosing recommendation in micrograms, but it's coming in the bag in grams. This is tiny. This is huge. So step 1, we need to find out what the dose is. So 3 micrograms per every kilogram. So 3 times 70 gives us 210. And that gives us the micrograms per minute, which is the dose. So step 2, how is that dose provided? The medication comes 2 grams, that's the grams, the big measurement, per 500 mils. So the dose we calculated was in micrograms, that's the tiny one. So we need to convert the grams to micrograms. So you can either do a straight conversion if you know it, it's 6 spaces, or work your way down. 1 gram is 1,000 milligrams, and then 1 milligram is 1,000 micrograms. So here it is, the kilogram, move the decimal the direction of the number of spaces. 1, 2, 3, 4, 5, 6. We need to add 6 zeros. 1, 2, 3, 4, 5, 6. So 2 grams is 2,000 micrograms. So the dose we need is 210 micrograms per minute, 210 mics per minute. The drug is supplied 2,000 micrograms per 500 ml. We need to know if how many milliliters 210 micrograms is in. Cross multiplication gives you that 0.0525 micrograms per ml per minute. So that's what you get when you figure out how the drug is supplied. But remember, they were asking how many milliliters per hour. So you need to take your per minute answer and multiply it by 60. So 60 minutes in an hour. And when you do that, you get 3.15. And because it's only one decimal place, 5 will round up to 2, and you get 3.2 milliliters per hour. This is not an uncommon calculation to do in a step-down unit or in a ICU. So I went online and I found a couple of other sites with some extra questions. This gives you another flow rate question. You can pause the video here and work this one yourself, but it gives you the answer too. And here's another drop factor question. If you want to get some more, I got those two off of dosagehelp.com. There's some practice questions there. There was also a dosage calculations quiz at this site. And then there was a good series of videos on YouTube where you can watch someone else kind of do some problems and do some math to kind of walk you through it. Now, if you do those practice questions that Professor Hannafin put out and go over the ones that are in your text, do some of these, I think you'll be fine. But if you have any questions, please let me know. On this YouTube video, when she gets to the end, she's done a calculation for 0.8 liters in 45 minutes, and she comes up with this number to program a pump to give 1,000 milliliters per hour, which sounds like a lot, but it is a lot because she is trying to give almost a whole liter in almost a whole hour. Sorry guys, that's my dog. Okay, good luck on your test.